Good afternoon, everyone, and welcome to our COVID-19 Workplace Readiness Toolkit webinar. Today, we're going to talk you through 5 key elements to help you make a safe and healthy return to work. My name's Ian Hislop, and I'm the Managing Director of Project Health and Safety Services Limited. I'm also the Health and Safety Lead on the COVID-19 project. I'm joined today with my colleague, David Lamont, who is a non-executive director of Project Health and Safety Services, and he's also the project lead for COVID-19. So, thank you all for taking the time to join us on the next stage of our journey in managing COVID-19. Before we start, I would just like us to pause and reflect for a moment. COVID-19 has taken thousands of lives across the world, with many more expected. Dedicated medical professionals and key workers have also lost their lives. To many of us, these are simply just numbers, but behind every number, there are grieving families, friends and colleagues. Please bear this in mind as we go through today's presentation. As health and safety professionals and managers, it is our duty, both legally and morally, to ensure that we do our utmost to prevent this disease spreading further. Today, we will outline some of the steps that can be taken to reduce the risk of further spread of COVID-19. Also, many people may be anxious about returning to work. We need to support them through this process and beyond. So, just some notes on housekeeping, everyone. The webinar is being recorded, and we can also share the link afterwards. Do please use the Q&A box at the bottom of your screen to ask questions, and we will endeavour to answer all of the questions at the end. Today's agenda, we will start shortly with a short audience poll. I will then hand over to David, and he will take you through the key points of the COVID-19 guidance pack. We will close with a short Q&A session and a summary. The audience poll. Please do take part in our short poll. It's only 10 questions. This will help us understand a little more about your workplace readiness plan. You will have 2 minutes to complete the 10 questions, and then David will take over from there. Hopefully everyone can see the poll there in front of you. If you just go through the questions, we will collate the answers. Okay, folks, just a few seconds left on the poll. Hopefully you've all managed to answer the questions. And I'll now pass you on to my colleague, David Lamont.
Okay, thanks, Ian. So quite an interesting set of returns there, set of answers. So what we're seeing is 63% of businesses have actually prepared a return to work following lockdown, so 63%, but 38% haven't. Now that may be because they've not yet returned to work and are still preparing. We asked, did you develop your workplace guidance, using workplace controls? 80% have said yes to that, but interestingly 13% not. And again, that may be partly because they actually haven't returned to work yet. Did you use a risk assessment? 88% have said they have indeed used a risk assessment, which is what we'll be talking a little bit more about today in this webinar, the use of the risk assessment in relation to workplace guidance tools. Did you make significant workplace changes? Interestingly, almost 50-50 there, so 56% saying they have and 44% saying that they actually have not made significant changes. Obviously that will relate very much to the type of workplace that you're in, size, floor space, etc. A lot of variables to consider, and again we'll go through some of that today. Did you consult and communicate the risk assessment and its controls with your workforce? So 81% did, and that's absolutely brilliant. That's what we would expect. We really need to involve our workers in the changes that we make to the workplace. We need to communicate these effectively. We probably need to remind people fairly regularly. One of the things we will be talking about, one of the things that we're looking at just now, is the behavioural changes that will need to take place in relation to managing a workplace to diminish and minimise infection transmission. Number 6 question, are you confident about the controls you've put in place? 81% are confident, 19% actually interesting saying they're not. So there should, it would be interesting to find out just what's driving that response. Are you maintaining and updating your COVID-19 workplace controls? 81% yes they are, and 19% interestingly are not. This is a very much a moving situation, and it is important that our workplace plans are adaptable and that we are relatively agile with them as the infection rates change, as in-country guidance change, and as you move from site to site in different workplaces. So it has to be highly adaptable. And one of the things we're going to talk today about with the guidance is that this is in fact a framework and it is adaptable. Have you identified your vulnerable people and groups? 81% yes and 19% no. Now here's an interesting one. Question 9, have you reviewed your fire and emergency arrangements? What we know is that entry and exit points will change. People rotation may change, so you may have fire wardens who are not on or not in the business one day, but maybe perhaps in the business the next day, where you've got job rotation going on. Similarly with first aiders. So these standard fire and emergency arrangements do need to be looked at, and perhaps also your first aider arrangements. So it's important that we get these back out and look and see just what that means in terms of the changes to the workplace itself. And is your COVID-19 business risk assessment current? So 69% are saying yes and 31% no. So it's an interesting set of results and probably does actually help us in terms of what we're trying to do today and setting the kind of tone. So what do we know about COVID-19, apart from the fact that it has certainly changed all of our lives in the last couple of months? COVID-19 is an infectious viral disease which can lead to serious respiratory type illnesses. It was first detected in Wuhan, China, and reported to the World Health Organization country office on the 31st of December 2019, which now seems like a long, long time ago. And for some of us, certainly who are based in the UK, some of that seemed very distant, very far away, and perhaps at that point in time, it probably didn't feel necessarily that it was going to affect us and impact us in the way that it actually has done. The outbreak itself was declared a public health emergency of international concern on the 30th of January 2020, and then officially became a pandemic on the 11th of March 2020. It is the first time that the World Health Organization has called an outbreak a pandemic since the swine flu pandemic in 2009. So some interesting points. First of all, there has been a new lexicon formed recently, lots of words and phrases that perhaps we have never come across before, maybe unless you were in the medical profession. Social distancing, certainly a term I had never really been aware of or never had to be aware of in the past. Lockdown, we couldn't envisage a situation where this would have happened. Certainly we may have seen such things in films, but we wouldn't have envisaged something of this magnitude affecting each and every one of us and our households. Respiratory hygiene. So people talk about respiratory hygiene, sneezes, coughs, hand hygiene. The new normal is a phrase being used in certain parts of the UK and probably elsewhere. What does the new normal mean? Well, it's how we kickstart our working life and our normal life post COVID-19. How do we work within the confines and the controls and the parameters that are set at a government level, but also, actually at a workplace level? And furlough. So in the UK, furlough has been a term that's been used. So many people probably used to that term now, but all of these terms are new. And there is one word, and lots of people are using it, unprecedented. And I think that's probably, for me, a word that I certainly have heard used a lot, and it hasn't probably been overused. This is unprecedented. So why did we set about creating our guidance? Well, we work with a lot of companies across the world, actually. So we work internationally, but we work also mainly in the UK. And a number of our clients and people in our network had come back to us and asked us, we are now beginning to prepare to go back to work. Can you help us? What do we need to do? And of course, what people were seeing was there are lots of guidance. There are lots of webinars. There are lots of places where you can source information. And in many respects, they are a myriad that actually becomes quite hard to A, nail down in terms of time, and also B, in terms of the extent and scope. And what I mean by time is the time lapse because things are changing. So last week, the guidance may have said X, Y, and Z, and this week it perhaps is saying something slightly different. And it's back to this piece about the workplace guide being agile and adaptable. And it's one of the reasons why we've kept this pretty much as a framework. And that's the way we kind of want to talk about this, as a framework and a toolkit. Because actually a lot of the hard work will come from yourselves in using the risk assessment and the workplace guide and the tools, because each workplace and each workspace can be very different. I think these are two terms we've started to kind of use, because workplace, largely, you think about, that could be a whole office block. But the workspace, where people are actually doing the task, is really where these controls manifest themselves, probably in the most difficult environment. And these are the areas where they're actually quite difficult to control. So the COVID-19 Workplace Guide recognises the highly variable nature of both international guidance and workplace configuration and workplace tasks. So it provides a framework and supporting templates. And we've used 5 elements which support you in developing what would be your workplace readiness plan. So the 5 elements are fairly straightforward. Element 1 is the COVID-19 Workplace Risk Assessment. And we really haven't adapted risk assessment templates, because a risk assessment template can be used for any hazard that presents itself largely. It's the thinking that goes on behind that, and obviously the output being the controls that you present at the end of that process. But a risk assessment is one part of it, and a key part of it, and it is core, as for the health and safety professionals on this webinar, it's core to the work you do. However, creating the workplace readiness plan, so actually detailing beyond the risk assessment, because there is detail. There's equipment, there's PPE, there's routines, there is entry and exit points being controlled. There may be new equipment, and a little bit we'll touch on later is some new equipment that started to appear to support people in getting the workplace ready. Element 3 is COVID-19 workplace inspections. And we've been quite deliberate in putting this in, because what we do need to do is, once we've set out our workplace readiness plan, as I've said earlier, is adapt that as things change and inspect to the relevant and current plan. So our inspections, and whilst we've got to continue with all our usual health, safety and environmental quality inspections and audits, this is very targeted. And it's not a complex template we've got, it's a fairly straightforward template. Really, the workplace inspection template calls out what you've pretty much put in your readiness plan, but actually it creates its own action plan at the end. So really the key thing is here is to say, where are you not conforming to either your risk assessment or indeed your workplace readiness plan. So the inspection is quite an important part of this. Personal protective equipment is another key part of the controls, and people are beginning to use these in different ways. And in fact, the guidance is changing. It's quite interesting to see how the guidance has changed. Even when you're going about your daily shopping these days, certainly in the UK, You know, 4 or 5 weeks ago, people weren't really wearing, you know, face protection or masks. Now, probably 50–60% of people in the retail environment are beginning to wear certainly face coverings and masks. And indeed, in some retail settings, what we are seeing is perspex screens and perspex visors being used. So, you know, obviously people are gauging for themselves what their risk tolerance is in their workplace. And I'll not obviously mention any of the retailers, but what I have seen is actually quite a wide variation. And I think that's an important point to make here. There is quite a wide variation in people deploying their controls. And again, what we're trying to do here with this is give people a little bit of support to think through logically how they might go about protecting their employees and making their workplaces safer for that return to work. And finally, workplace equipment, because there have been some changes in workplace equipment. We've also got some posters, so we have developed some collateral as well to use, because I do think, and I've said it earlier on, I think behavioural change, and we're seeing it already, you know, when you're out for your, as we were 2 or 3 weeks ago, our daily walk, that social distancing thing, there's a different etiquette now. You know, when you're in a place where there are maybe slightly larger numbers of people in terms of your cough and sneeze, that 2 metre distance. And of course, that 2 metre distance, and whilst we've said 2 metre distance in these guidance notes, for some countries that's different. Some countries have set 1 metre, some countries have set 1.5. So again, context and the locations that you're operating in is really, really important here. It's why, again, we've set this up very much as guidance framework toolkit, as opposed to very specific detail on controls, because that's where you need to come in here as operational professionals and health and safety professionals. So we start with the workplace risk assessment. I'm only showing you our typical, you know, our own risk assessment template that we use at PHSS. You will have your own, but clearly what you're now starting to think, what we do have, and we have it in the pack, is we have a kind of straw man, if you will, of a hazard template, which allows you to kind of look at what we'd see as some standard hazards in and around COVID-19. But again, you do need to think yourselves, and you know, you walk through your workplace. And I think when you're doing your risk assessment, you're really having to do a number of things here. You're having to do a walkthrough of the location, the physical location, clearly, and how people use the workplace. I think you're also then having to start to think about how people move around with their tasks. You know, what does all that look like? So it's really about thinking through almost in a flow. What does that flow look like in terms of moving around the premises, but also what does that flow look like in terms of task? That in itself will then, you'll be able to see, well, what kind of hazards are we encountering here? And again, if you think about logically, you know, the issues in and around social distancing, and what are we trying to do here, and many people are using this is breaking this chain of transmission. And that's clearly, you know, at the root of what we're trying to reveal here in the risk assessments. It's breaking down that chain of transmission, and whether that's through points of touch, or touch points as some people call them, whether that's through respiratory hygiene, or whether that's through hand hygiene. So that's the kind of thinking that we want you to do. So we have actually carried out a couple of these risk assessments. I'm maybe just going to ask Ian to, just because Ian has actually been involved just recently in doing some risk assessments with one of our clients. So it might be just worth Ian just saying some, you know, just giving our audience some feedback on some of the challenges that you've encountered as you've been doing these risk assessments.
Yes, thanks, David. Everyone knows that risk assessment and risk management is the cornerstone of modern health and safety practice. And I'm pleased that the poll suggests that many of you have identified the vulnerable people within your organisation, which for me would be the starting point. You've identified the people who are most at risk, and you're keeping them away from the workplace. So the next stage in the plan would be to approach your workplace as you drive up or walk up to it. The entrance, what does it look like? The car park, think about your car parking arrangements, your signage, because these are the points where all your employees must be alerted to the new environment that they will be entering. Highly visible COVID-19 signage, strict entry-exit protocols should all be in place, and ideally these should be communicated to employees before they attend for the first time. these are just some of the points that you need to consider. And also, just while I'm on, that for the audience, if you hover over the bottom of your screen, you'll see the Q&A option. You can click on that and send us questions directly, and as I said, we'll try and answer them at the end. Thanks, David.
Cheers, Ian. Thank you. Okay, so we then complete our risk assessment and we start to use the workplace guide as a template. So that kind of develops out the thinking, and it includes everything such as, you know, one-way systems, communication methodology. It might be posters, it may be toolbox talks. Some people have got some purchased electronic devices which they have at the front of their premises to communicate changing messages. And again, this is about prompts. Again, the prompts to try and change behaviours as people come to work, as people are in their work, and as they return from work to home. And some of these behavioural changes actually need to continue whilst people are at home. And we'll talk a little bit about that when it comes to PPE and people returning home with workwear, including suits or shirts or wherever that may be. And there's obviously protocols around cleaning and cleanliness for workwear.
Yeah, David,
yeah, you can come in there, Ian.
You know, just I noticed from the poll as well, there was quite a few people who hadn't reviewed their fire and emergency arrangements. This is critical for this plan. You need to think about your muster points, exit stairwells, etc. Will you have enough first aid personnel to cover any staggered working arrangements? How your welfare area is going to look? Simple things like smoking shelters will need to be considered as well. Thanks, David.
Thanks, Ian. So element 2 is the workplace readiness plan. It provides the blueprint for how you will reconfigure your workplace and the workspaces within. It provides your organisation with a plan and a record of what controls you have deployed to protect workers at your workplaces. And again, you've got to remember, you know, you may have a regulator who wants to look at some of this information, and this guide helps you produce the necessary documentation, not only to communicate to your staff, your subcontractors, your contractors, but also to a wider audience should you need to do that. So then we go on to element 3, because once we've reconfigured the workspace and the workplaces, we need to go back in, we need to inspect. So again, within this template, we've got a workplace inspection plan. So again, you might need to consider how often you want to inspect your workplace. So it could be daily, it could be weekly, and I suspect that will be risk-led, where you see high priorities, where it's likely that there would be a breakdown of the controls, where it's likely that people may not necessarily have taken on board those controls. Then I do think you probably want to target your inspections and your frequency of inspections in and around that. But adapting the workplace health and safety inspection template is part of this. And again, you can do that with this tool. You just look at how have you reconfigured your workspace? What's it telling you in the plan? What's it telling you in your risk assessment in terms of controls? And that's what you're looking at. And it's no different in many respects from what you do day to day as health and safety professionals, or if you're a director or a manager of a business in doing your walkarounds. So element 4 is the range of PPE. So very rarely we've seen people in a retail setting, wearing a Perspex visor, perhaps security guards. We may have seen that before when people are taking cash. The high-vis vest to the left is a prompt. So people are getting quite innovative with some of the collateral that they're using, some of the PPE that they're using. So this high-vis vest, for example, simple messaging could be front and back. It's reminding people. And I do think, until some of these behaviours are perhaps ingrained, then, these are quite good prompts to be using. And there may be different prompts you can use with different workwear. Visors, face masks and gloves, only part of the range of PPE that is available. And of course, again, different countries are saying different things about face coverings and masks. So not everyone necessarily has adopted face coverings or masks in a public situation. Some countries are being more rigorous than others. And again, you need to reflect on your country of operation and indeed your policy as a business. So your policy as a business globally may be that face coverings and masks are standard. Your policy may well be that you will follow the country that you're operating in's guidance, and that's a conversation that you need to have when you're developing your workplace readiness plan. And of course, there's new equipment coming through. We're seeing different bits of, we're seeing new products that are being developed. I've got a few more innovative products at the end of this slide that I'll show you, but these are some of the basics. So, as we are all going to our supermarkets at the weekend, we're seeing barriers, we're seeing people managing queues, which is quite interesting. So, I've probably seen people migrating from probably what would be nightclub setting or large gatherings like football matches. People who manage crowds are actually moving into the domain of managing queues at supermarkets. So I've been watching some of this as it's been developing. So queue management, one way, two way, all of that kind of stuff, people are now beginning to think about, and that's all about managing social distancing and maintaining separation. And again, prompts like the tape. So many workplaces now, the yellow and black hazard warning tape, ticker tape type thing we're seeing that in many workplaces now. And again, it's a good prompt. The perspex screens, so where people are having lots of face-to-face contact, then visors, perspex screens are being used. And then floor stickers, collateral being used for flooring, again, to try and prompt people as to what, how they need to behave in terms of social distancing and perhaps hand hygiene and the like. And I'll come to some other slides which will show you some of the things that people are using actually for hand hygiene. There's also some other things, and people have seen these probably on LinkedIn and other places, doors now that have foot controls for opening and such things. I think we'll see more of that starting to happen, some of the innovation that's coming in and around, and it's interesting to see what people are doing to adapt their businesses actually, and and flex as they need to provide equipment that helps people manage their workplace better. So that's the 5 elements, but within the elements, what we do is we've got guidance. So, and again, this is for everyone to consider. So guidance 1 is travel to and from work, and that might be in company vehicles, it might be in personal vehicles, or it could equally be on public transport. From a public transport perspective, obviously in-country guidance and the transport companies themselves will have arrangements that you will want to think about. But you'll also want to probably provide your employees and your stakeholders with information around public transport, making yourself aware as to how people come to and from their work, so you can provide information to them. And a lot of this is indeed that's about reminding people about their behaviours on entering buses or indeed trains. But again, interesting, left-hand picture here, clean vehicle touch points. So I know myself, I've started to do that. When I get in my car and at the end of driving or starting again, I will get out a wipe or I'll get out a hand sanitizer and I will clean the steering wheel, I'll clean the gear stick and any of the kind of buttons and levers that I use regularly. And that's now become, strangely for myself, that's now become a habit, something we probably wouldn't have done before. And then seating arrangements in vehicles, company vans. So we need to think about that, so how we can maximize social distancing where possible. And that's not easy. Clearly, the configuration of vehicles is highly variable, and how you manage that is quite an important aspect to this travel to and from work guidance. But what we're trying to do here is prompt people to think about this. For guidance 2, I think it's important, as Ian has said, that when people come back to work, particularly when you're restarting, that you want to have a fairly well-developed induction that speaks to the risk assessments that you've carried out, that speaks to the workplace guidance plan, and then you can adapt that. Now, what we've got is we've got a small toolbox talk template, so you would just adapt that with your information and you put that in, and you're going to communicate that to your staff and to people who come to your business regularly, visitors it could be, or indeed people who deliver deliveries and how deliveries are accommodated. That's quite a big issue for some organisations, especially where there's lots of material being offloaded, and how that material is moved and stored. So all of these things need to be thought through. The induction, though, is a key piece around providing people with key information about the risk assessment and the workplace guide.
Yes, David, as well, it's worth mentioning, it's, the induction, at the point of induction, it's a good opportunity to discuss your employees' current well-being and, see how they're coping with working from home or shielding or whatever that may be, and also to welcome them back to work. Thank you.
Thanks, Ian. Okay, and guidance 3, site entry and exit control points. And again, obviously, as I've mentioned earlier on, the social distancing, certainly in the UK at the moment, it's 2 metres. There's a debate about that just now, as there will be no doubt across different countries. And again, what's hard to try and predict here is how this viral epidemic, pandemic will change. You know, if there's a second spike, what will that mean? Will that mean increasing social distance as the numbers reduce, the R number that we've all become familiar with? If that reduces, will the social distancing reduce? So again, part of this is really important that we're keeping an eye on what's happening with the in-country guidance, and probably trying to get familiar with one good, sensible source of information. So in the UK, the governments, the devolved countries provide their guidance, the HSE provide guidance, and there are good industry guidance coming from industry bodies. But site entry and exit control points, we want to make sure that people, when they come to site, that they understand what the changes are. So, you know, you can use your entry point at that stage to either provide induction or provide posters or provide a short toolbox talk as people come in. I think it's also quite a good idea to try and present people with the, let's say, the new protocols that you've got. So you might have certain signs, you might have certain lines, you might have certain symbols or icons. And obviously you don't want to have too many of these necessarily, because it confuses people. But what you just want to try and show them is, look, here's how the workplace has been set up. You know, if you're seeing a one-way sign, well, you stick to the left or you stick to the right, depending on what you decide to do in your particular workplace. So I think introducing people to these changes, this is an important part of site entry. And exit, obviously you want to make sure that, you know, people on exiting are, you know, hand sanitizing, for example. So you might have that at your entry point, and clearly you might also have it at your exit control point. And you may also have a reminder about transport. So again, you're trying to kind of prompt people. You're trying to, you know, ensure that people's behaviours change at the important stages that they move through the workplace. And again, that's why flow, I think, is quite important. So you're thinking about people's movement through the workplace and providing those prompts. Guidance 4, and this is only really because some of our organisations have been working in active healthcare zones. And our point at this stage is you really do need to talk to the medical centre itself and follow the protocols clearly that are in place there, because these will undoubtedly be more advanced. And you may have to make some decisions about risk as to whether or not at certain points in time the work you might want to be doing in those active healthcare zones can in fact be carried out. So it may well be in certain countries and in certain situations that can't be done. But it's important that you recognise it. And I think this is again about the changing, you know, it's about changing workplace settings, and we need to be, you know, we need to be mindful of that. And as I mentioned earlier on, part of the new lexicon is social distancing. So, you know, you can see the kind of general photographs we've got in this slide here. You know, people are now using prompts, you know, nudge. So people talk a lot about nudge theory. Actually, I think nudge theory works quite well, perhaps in this new environment. And if, for those of you who haven't read that book, it's actually a good book to look at, nudge theory. You may want to look at it. What it does, it uses visual prompts to help people change their behaviours. And really that's kind of what you're seeing here. And I think, you know, the best workplaces, the best set up workplaces to minimise COVID-19 transmission, I think we'll use a lot of this nudge to manage behavioural change. And I think that's quite a good way in many respects in looking at this.
Yeah, David, as well, I think, you know, this is an important point around personal responsibility and self-discipline when it comes to maintaining the distance between people. And again, this starts with your employee engagement, and that really comes to the fore. You need to discuss all aspects of the task and listen out for any shortfalls or concerns that the employees have. Key control measure is social distancing. Just a reminder as well, folks, we have given you a lot of information so far, and if you do have any questions, please send them through the box at the bottom of your screen. Thank you.
Thanks, Ian. And so guidance 6, where social distancing is not possible. And I think it's important to say again that in some countries where social distancing isn't possible, some countries are saying the work shouldn't take place. So again, we need to just think of that in a country setting. And And also, if you are going to, you know, have a situation where you're within the social distancing parameters, then there are different things that you may wish to adopt, and that could be facial coverings. It could be how people are working, maybe not face on. It could perhaps be perspex screens. Again, it will be very much related to the task. So we need to consider the task. It needs to be practical. It needs to be risk-based, and it probably does need to very much look at what the guidance is within the particular country of operation. Guidance note 7. A big part of this is personal hand hygiene and the use of hand sanitizers, for example. And there is a lot of information out there now. So certainly, I have, you know, at a personal level, I've never washed my hands as much, and I am using various emollients to make sure that they're not cracking up and getting other problems. But you know, there is no doubt that people are now becoming very aware of touch points, and when they're using equipment, for example, that might be used by many people, not only are they hand sanitizing, but they're also cleaning the equipment. So levers and buttons and all of that kind of thing falls into, you know, the kind of personal hygiene and the use of hand sanitizers equally. So there's a whole lot of behavioural change, and I think the important thing for us here in terms of the workplace guidance plan is providing, you know, appropriate hand sanitisation equipment, materials, placing them in the right locations, making it easy for people to use, making it highly visible, and encouraging people to do that. And again, this is about breaking this chain of transmission. Guidance 8, workplace cleanliness. Again, some of the people we've been speaking to in their own workplaces, they're looking at the priorities. So they're looking at areas where there are perhaps many people congregating. They're looking at the areas where touch points are really, you know, there's a lot of touch points that are used very frequently, like door handles. They're maybe reducing perhaps sharing of equipment as well to try and, so maybe keyboards and laptops and PCs are not being shared, mobile phones and the like. People now pretty much having their own equipment for themselves. But this workplace cleanliness piece is really important, and perhaps reconfiguring. So you may have a cleaner that comes into your office and they will have a particular routine. I think it's important that you look at that routine and you liaise and work with the cleaning company or the cleaning operatives to make sure that the regime you've got is fit for purpose, and that it targets those areas that you need to have that just a little bit more attention in terms of hand hygiene and the like.
Yeah, David, I think it's also worth mentioning the cleaning teams will need to put it up to speed with the new protocols as well.
Indeed, absolutely. Subcontractors and main contractors. So this is about stakeholders. So it goes beyond your own workforce. This is about people who visit your site and people who work for you at your site. So guidance 9, workwear cleaning and disposal routines. So again, you will want to put in your plan some information that helps people understand the best way to move material, their own PPE from work to home if they're going to do that, or indeed some organisations are providing cleaning at their sites. And again, that's something that you need to consider, because obviously, again, to reduce that chain of transmission, we're trying to kill that virus whenever we can, and cleaning is a big part of this, so especially where people are perhaps wearing the same PPE for prolonged periods of time. And again, differentiating between what's to be disposed and being quite clear. If it's one use only, we'll let people know this is one use only and it's binned. And then of course you've got to then look at how you dispose of workwear. You know, what's the disposal routines? How's it going to be binned? What's the pickup regime for materials that are going to be moved from site to waste? And again, that might even mean working with your waste contractors. We do need to look a little bit about the supply chain, and it is almost a kind of supply chain thinking here. And I'm back to that word flow, because I do think, you know, almost thinking about things in terms of a workplace flow or a workflow is quite a good way of actually doing this, because that's the way the virus itself will transmit. It's going to be along these flows and through these chains. And that's what we're trying to do with these guidance. We're trying to break down those chains. Workplace meetings, we've all probably now got quite familiar with Zoom or Microsoft Teams or Google Meet. We're probably all getting quite adept with that. And again, you'll need to make decisions about your workplace as to how you're going to hold meetings. Clearly, we'll all have to still communicate. So we need to think, we're going to introduce social distancing into our meeting rooms, how are we going to control exit and entry into meeting rooms, what will the length of time be for a meeting. So again, this is a part of the guidance note we've got. We've got that information that gives you a prompt, so you can start to build, okay, well, what does your workplace meeting situation look like? Who should be there? And perhaps thinking only about essential people coming to meetings, and do they all need to be there in person? So there's lots of different configurations that we can consider to minimise transmission opportunities for the virus in a workplace meeting situation.
Yeah, David, and I suppose it's just worth mentioning, you know, people have adapted remarkably well to these new solutions, well, not new solutions, existing solutions. So we've got to keep promoting them and use them whenever we can. Yep, thank you.
And guidance 11 is communal and welfare facilities. Again, areas where people congregate. You may, you know, so for example, some basic things in and around, you're encouraging people to bring their own food to work, perhaps vending machines, you know, where there's key touch points that are either cleaned more regularly, or there's some other means of obtaining food from these machines, or indeed they're not used. People are encouraged, certainly for this period of time, to bring food to work in their own containers and take those containers back. So there'll be shared facilities like kettles. We'll need to consider social distancing within the welfare facilities, offices and canteens, and generally these communal facilities. And I think that's where it comes down to things like layout, desk separation, use of advisory posters in these types of environments, pedestrian flow, one way, for example, and always, again, keeping social distancing in mind.
David, it's probably worth mentioning the little red dots that we spoke about the other day.
Yeah, that's a good one. You made me mention that, actually.
Yeah,
so I'll tell you. So one of our clients has explained to us that they've got a pack of sticky red dots, and what they do is they walk through the workplace and they place the sticky red dots onto touch points that are, you know, used a lot in the workplace. So door handles, kettle switches, plug points, printer switches on, off, etc., etc. So these red dots, again, they're a bit of a nudge. They're actually, you know, people are just having to step back a bit and think, you know, do they need to put gloves on? Do they need to clean the device before they touch it? Do they need to clean their hands after touching it? And again, the situation with this will be multivariate. So, you know, it's about trying to build in some of this thinking before people encounter it at your workplace. You know, and actually the red dot system was actually quite good. We'd only heard this, I think it was last week or the week before, and that seemed to be a very good way of prompting people in the workplace. And guidance 13, there will be vulnerable people who, you know, are part of your stakeholder group. They may work for you, they may be visitors to your organisation. We do need to think about that. So vulnerable, there obviously is a definition of, you know, who are vulnerable. So for example, some people with comorbidities, such as diabetes, or people who are maybe going through cancer treatments. So again, you need to think about how, you know, that will be managed at your workplace. Are we, you know, encouraging people to come to the workplace and doing something a bit different with them to make sure they're protected? Or are we actually not encouraging to come to the workplace, and we're using different means to communicate with such people? And indeed, how do we know that such people are in our midst? And again, this is where the prompts, for example, you know, you may have people coming to work now who are arranging to come to a meeting. They may be visitors, they may be salespeople, etc., etc. So there may well be questionnaires or questions that you need to ask people in advance of people now coming to your workplace. And this is really, again, just thinking through almost a day in the life of your workers and how they walk through and how they flow through your business, and how other people come to your business and interact with your workplace. And as we mentioned earlier on, fire and evacuation protocols and guidance 14, so we do need to review these, first aiders, etc., etc. Has there been a change where that might be compromised, for example? And if that's the case, what's the mitigation? So just a little bit about some equipment innovation. So left-hand side top, LCD hand sanitizer display, quite a good way again at entry points, where perhaps you have a visual display with a changing message, and that message, you know, could be changing based on information received that day. And then of course you've got your hand sanitizing equipment nestled within that LCD display. people counter display, so how many people are in a room, how many people are in in a workspace. It could be a warehouse, it could be a workshop. So you've got a kind of an idea of the crowds that are actually in, and you might want to set capacity. So, you know, you are starting to see people now, for example, in the retail, the pub sector, restaurant sector, talking now about capacity. And you are hearing business owners talking about we can only now operate at 60%. So what does that mean by way of numbers, and how are you actually going to manage it? And so again, this comes back to the entry and exit points, but also, you know, using some innovation here to manage that. All that said, that still, you know, you still have to observe social distancing, you know, with the numbers. But clearly, what we're trying to, or what's trying to be promoted here, is that you have a certain number where social distancing can be facilitated, because that number is kept below a certain threshold or capacity. And then some organisations, temperature check tablets. Some organisations are having that at the entry points and exit points, so people can be informed if, in fact, they are running a temperature, and that can be a communication to in some countries go and get tested. So many countries now, if you have got high temperature, persistent cough, etc., displaying certain symptoms, then you can quite easily, quite quickly book tests. In other countries, that might not be the case at this stage, in which case there will be other protocols perhaps in place. That may mean self-isolation and the like. So again, all of that needs to be part of, you know, the plan. So that's I think we're just ahead of time. So that's pretty much a kind of walkthrough of the workplace guide, the 5 elements and the guidance notes. What we'd be happy to do now is for Ian to just basically go through some of the questions that have perhaps come through this session, and give you our view on the answers at the moment. What we will try and do is obviously communicate with you after this webinar, and if you have other questions, you can come back to us, and we'll field these as best we can. So Ian, if you could please just take us through the Q&A, that would be very helpful.
Thanks, David. A couple of questions coming in now. Can't believe the level of detail you're providing here. Nudge factors are really important with interface with any safety observation systems. Thank you for such a useful and succinct presentation. Yeah, and we are looking at embedding more behavioural safety aspects into the pack. We're working with a colleague currently, so we'll hopefully do another webinar in a couple of weeks' time on that, getting those behaviours into the pack as well. Another comment regarding the thermal was made that this is not really recommended due to other unrelated health factors. Yep, absolutely. That every workplace is going to be specific, and you will need to consider things like health factors with your staff. So again, that's where you speak to your health and safety advisor or take further advice. Next question, should we be encouraging asking vulnerable people to return to work? At the moment, the advice from certainly the government in the UK is not to ask them to return to work. Should they be treated any differently if the correct hygiene measures are put in place and hand washing and cleaning practices are followed? Again, the government guidance at the moment in the UK, and this may vary across the world, is that vulnerable people should be shielding. That's all the questions. I would just like to, oh sorry, no, just another one came in here. And this is from Dubai. Hi, if someone loses his life due to COVID-19 in the workplace, is his family eligible for compensation? Can't answer that one, unfortunately. I'm not fully aware of the regulations in Dubai, but we will get back to you on that. We'll do some research and respond after the webinar. So that was all the questions. Just a few reminders. It is a fluid situation. It's ever changing, and your COVID pack will need to be updated constantly when new local and government guidance emerges. You need to test your plan as well periodically. Make sure your control measures are working. You need to inspect your workplaces and make sure that the additional COVID-19 control measures are working. I would also strongly advise that you speak with your health and safety teams regularly, and speak with your staff to ensure that they are comfortable with their return to work and the measures you have in place. Also, just like to mention that the pack is available from Project Health and Safety Services, as is any further advice that we haven't covered on the webinar. David, anything else to summarise?
No, I think that's enough from us today. I think what we've tried to do is take you through our thinking. We've tried to respond to the clients that have asked us specific questions. I think what we realised quite early on here was that there wasn't one place necessarily that we could go to, and of course this has been changing over a number of weeks. So we decided to take it upon ourselves to develop some guidance around this that took best practice from other guidance, including the World Health Organization and other leading bodies. And what we've tried to do here is assemble a pack that makes some sense of that and provides a framework and a toolkit, not necessarily all of the answers, of course.
Okay.
So that's fine.
Thanks, David. So, as I said, we'll hopefully be back in a couple of weeks where we'll have woven some more behavioural aspects into the workplace plan. Thank you all very much for attending, and we will hopefully speak to you all again soon. Stay safe. Thank you very much. Bye.
Thank you very much.